Afternoon, everyone, and welcome to this June 17th regular meeting of the Commission to Address Homelessness. We will begin with the Pledge of Allegiance. Stand and let's see who I'd love to call on. I'm going to call on Commissioner Foster to lead us in the pledge.
Absolutely. Place your right hand over your heart. Ready, begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Foster. The agenda for today contains a brief general description of each item to be considered. Except as provided by law, no action shall be taken on any item not appearing on the agenda. The Commission to Address Homelessness encourages public participation. If you wish to speak on any item appearing on the agenda or during public comment, please complete a speaker request form and turn it into the clerk prior to the reading of the items. Speakers will be given 3 minutes to speak. The clerk will run the timer and announce when your time is up. Public comment may also be submitted electronically by emailing cob.response@oc.gov. With that, we will move on to the roll call. Madam Clerk, will you please call the roll?
Thank you. Commissioners, please indicate your presence when I call your name. Commissioner Cunningham?
Here.
Commissioner Hurst?
Here.
Commissioner Sarmiento?
Here.
Commissioner Wynn?
George Peppas, proxy.
Commissioner Spitzer? Commissioner Kelly?
Here.
Commissioner Lodby?
Here.
Commissioner Foster?
Here.
Commissioner Parks? Commissioner Shinagawa?
Here.
Commissioner Vasquez? Commissioner Rose?
Here.
Commissioner Bruno Nelson? Commissioner Pitts?
Ready.
Commissioner Bobko?
Here.
Commissioner Trejo?
Here.
Commissioner Rios Faust?
Here.
Commissioner Morse?
Here.
Thank you, noting for the record that we do have a quorum.
Thank you, Madam Clerk. Housekeeping item. As a reminder, please be aware that the room is hot mic'd for the live stream of the meeting. Additional microphones are placed on the table in front of you. Commissioners, please speak into the microphone so it may pick up your comment for the live stream. Please keep any side conversations to a minimum as they may be picked up by the mic. At this time, we will take public comment from any members of the public wishing to speak on any non-agenda topics that are under the subject matter jurisdiction of the Commission. Madam Clerk, do we have any requests to speak?
We do not have any requests to speak.
Thank you. Before we move into the Commission member comments for today's meeting, I want to take a moment and welcome our newest Commissioner. Is Lieutenant Karen Lodby here? Oh, she is, because you don't look familiar to me. Welcome. She is from the Orange County Sheriff Coroner's Department as the Orange County Sheriff's Department representative. If there are any comments, updates, actually, I'd just love for you to say a few words of welcome to the Commission to Address Homelessness and just give us a few words of encouragement this morning, today. I don't even know. Sorry, I'm a little frazzled today.
Thank you.
Yeah.
Thank you, and thank you for having me on the board. I have taken over the Behavioral Health Bureau with the Sheriff's Department, and so I have 18 deputies that their primary purpose is to help the homeless individuals in our population in Orange County and also those that are experiencing a behavioral health crisis. And so those two things do overlap quite often.
Yes.
And I appreciate all of you being here, and I really look forward to looking into the gaps as we continue to try to address homelessness.
Wonderful. Thank you. We appreciate you being here. Welcome, Commissioner Spitzer.
Thank you, Sam.
Before we move into the Commission members' comments for today's meeting, oh no, I already did that. Actually, I'd like to take a moment to see if there are any updates from any of our commissioners. You guys have any great news you would love to share? Things that are happening in your world? Exciting moments? Commissioner Hurst, Vice Chair Hurst.
I just want to celebrate together the opening of the groundbreaking, I should say, of the Salvation Army's Center for Applied Research Innovation facility at the Anaheim Center of Hope. We had a tremendous event yesterday, great community response. Almost about 200 came out, and many greetings from our broad elected officials. Several of you sent wonderful staff and greetings. Thank you so much for that. Really appreciate Supervisor Chafee coming and sending his best and giving a certificate for the event. It was an extraordinary day, and just want to make it aware to the commission that it'll be completed in about 12 months and will serve as a resource for the entire Orange County community, where we're bringing state-of-the-art innovation tools from Silicon Valley and some of our top academic spaces straight into a 14-acre comprehensive homeless campus and solving big problems together. We're going to reach out to you. We're going to call on you for help, ask you for help, and really leverage the resources of our community and tremendous service organizations like the Salvation Army and many others to really push for innovation and solutions in the homeless space that we haven't seen before. So we're super excited, and again, just want to celebrate that together. Doug mentioned to me last week, and I think it's a point worth noting in this headwind environment for homeless services. It's great to count any win, isn't it? And we saw $18 million come in philanthropically, 100% philanthropic gifts for that facility, on top of the $47 million in public-private funds raised for the Center of Hope adjacent apartments. So as we say together, and we've said in this commission meeting, we know there are resources there if we can connect with the aspirational hearts of people to bring bold life change. And that's something everyone on this commission aspires to do. We've heard your stories, and thank you for celebrating that with us. Appreciate it. Thank you.
Congratulations, Commissioner. That's why you are in the philanthropic seat.
Yes.
That's right. Do we have any other updates anyone would like to share? Wonderful. Thank you for sharing. We will now move into the discussion items on our agenda. Madam Clerk, will you please read the first item?
Item 1 is the Commission to Address Homelessness update, which includes updates on the membership and the COC program Notice of Funding Opportunity. And we have no requests from the public to speak on this item.
Thank you. Doug, will you please provide an update for us?
Absolutely. Good afternoon, everyone. Thank you for attending the June 2026 Commission meeting. I have two updates for the Commission to Address Homelessness update. The first is a reiteration of our welcome to Commissioner Lodby, who's joining us for the first time today. As she mentioned, she plays a critical role in leading the Sheriff's Department's efforts in addressing homelessness and partnering with not only the people they serve, but all the partners here in this room and outside of the room. The second update that I'd like to provide is a continuation of a topic we've been talking about really since October, November of last year, which is an update on the Continuum of Care program funding. There's really two pieces to this particular update today as we look at our timing. So a very large amount of the discussion we have had over the last 6 to 8 months has been regarding the what's going on with the COC NOFO for the fiscal year of 2025. As you may recall, this NOFO, the federal government, specifically HUD, released a NOFO in November of last year, which is considerably later than they traditionally do and somewhat unexpected due to previous past appropriations. In December, several groups, including the National Alliance to End Homelessness, brought a lawsuit against HUD in regards to this particular NOFO. If you remember, not only was the timing of the NOFO incredibly different, but there was a significant amount of substantial changes to the NOFO itself. As a friendly reminder, the way the COC works, and not to get too deep into the weeds, but funding that comes to projects locally here and throughout the country through the COC program NOFO, each community, each continuum of care is required to reapply for funding every single year. So when you see significant changes in a NOFO like this, that means the existing programs that are looking for renewal funding that have been going on for years and years and have helped folks get housed and stay housed and provide services, those programs are really thrown for a loop. So what I've really appreciated from my seat as the director of the Office of Care Coordination is the support that this commission has provided through this time of sort of challenge, I would say, in terms of ensuring that our programs are funded. So the first prong, like I mentioned, in this two-prong update is that fiscal year 25 update. So as I mentioned, several parties, including the National Alliance to End Homelessness, had brought HUD into court in regards to this, the 2025 NOFO. It's still working its way through the court system, but what we do have and what has happened, and we spoke about it at our last meeting, was that the appropriations bill that was passed or the Appropriations Act that was passed in early February provided specific deadlines that HUD was required to meet in order to ensure that programs and grantees renewed their funding in case of a delay in awards. So we've seen that delay in awards. So those guidelines that were in the appropriation bill have kicked in. And HUD, as you see here up on this slide, has committed to renewing funding to all grantees across the country under the same format and expectations as they were awarded the year prior. So for us, here in our community, on March 31st, there was $2.5 million worth of funding that came to our county. On April 27th, HUD announced that they'd renew all grants that expired in Q2 between April and June, which qualified as $12.1 million for Orange County. And then finally on May 21st, HUD had stated that they will renew Q3 and 4. So ultimately, I think good news for the fiscal year 24-25 funds here in Orange County. That looks like $38.8 million worth of funding that helps well over 1,200 individuals and households here in Orange County either get housed or a majority of them to stay housed. So we're excited, I think, and encouraged about that. The second piece of that update, that second prong is we're in June, and the appropriations bill that I had mentioned that really helped us for the FY25 NOFO also provided parameters for FY26. And what it said was that HUD would need to release the FY26 NOFO by June 1st. So HUD did just that on June 1st, announcing approximately $4.4 billion of funding available nationwide, which includes $52 million designated for domestic violence, dating violence, sexual assault, and stalking bonus projects. As anticipated, the goals, objectives, and overall framework closely mirror the changes that they were looking to make back in November and December. Our office has reviewed that NOFO, as you would imagine, and some of those changes that, the major changes that appear in the FY 2026 COC program NOFO are listed here up in this slide, which is addition of, we saw in this NOFO that there are additional new eligible project types included in this NOFO, meaning HUD is willing to fund transitional housing and supportive services only, which is great, and we're encouraged with that. But the challenge is we are limited, and not to get too much into the weeds, we are limited in the amount of funding we can apply for, and that includes that funding includes all the projects that are looking for renewal funding. So although we're excited that they're willing to fund two separate new projects, that also means that we have to consider other projects that will no longer get funded that are currently getting funded and currently serving people. The reduction of Tier 1 funding to 60%. So if you may remember, year over year, Tier 1, especially in this very specific exercise, means that essentially Tier 1 is the category in which if your project falls into, you're probably going to get your renewal funding. So historically, HUD had put that Tier 1 at 90% of a community's funding. So if your project fit within Tier 1, you were sitting back feeling a little better about yourself compared to being in Tier 2, where you were really at risk of losing funding. In November, they wanted to shrink that Tier 1 to 30%, and so you would essentially make 70% of every community's funding really at risk. What we saw both in the appropriations bill or act, and then followed appropriately here in their NOFO is that number landed at 60%. So yet again, essentially 60% of our $38+ million we feel pretty comfortable with, but now instead of worrying about sort of 10% of our funding, we're worrying about 40% of our funding. Significant revisions of scoring criteria, including requirements related to supportive service participation, substance use treatment service availability, and expanded collaboration with law enforcement. So we are working as an office and as a COC closely together to not only ensure that our strategy to this application, this NOFO, is accurate, but in the coming weeks and months, we'll be working very closely with our behavioral health partners, our law enforcement partners, and other partners to ensure that we are in compliance with the expectations. And then HUD also modified the way they will evaluate projects. So the application is due on August 26th up to HUD. That requires a boatload of steps between now and August 26th. It also requires a community to have, because it's a one big collaborative application, it requires a community to have a really coordinated, calculated strategy. I appreciate the staff on my team, who is, our COC staff, and then our board, our COC board, in really navigating these uncharted waters. And I'll speak for myself. Although I'm not incredibly excited about all of these changes, I'm feeling more confident today than I have been throughout any point in this process that we here in Orange County are going to position ourselves in a way to not only maximize the funding opportunity, but to ensure that the funds that we do get really help us improve our system and ensure that folks that need these resources are going to benefit from them. So with that...
Doug, before we leave, if you don't mind, just...
yeah, please.
Can you go back to the, I guess, the new eligible project types for fiscal year 2026? And you said transitional housing and support services only. Mm-hmm. So number one, what qualifies for transitional housing? What sort of, units, what sort of investments would that cover? And you're saying these new project types would come at the expense of other investments that we could no longer make. What would those? I mean, that's something I think that'll be discussed further, but maybe break down what transitional housing would look like.
So, and Zulima can jump in at any time as the technical expert, but transitional housing has a very specific definition. I know we often use the word like transitional housing or temporary housing as a generic term in our industry, just talking about housing that's temporary or transitional. Here with HUD, it's a specific model that essentially has a couple of principles that make it unique. It's a time-sensitive transitional housing. So transitional housing, it can only last up to 24 months. It often comes with a service requirement, meaning that an individual has to engage and participate in services. Do you want to add anything else, Zulima?
For the funding opportunity, it requires a minimum of 20 hours of participation. And it also doesn't follow housing first principles, meaning that if the person does not follow the different program rules associated with like sobriety or meeting the service participations, they're at risk of being exited from the program.
Got it. But, so this transitional could also be considered congregate housing as well, because if it's time sensitive, or if it's limited by a certain time period, would that be something that would be considered transitional?
Traditionally, the transitional housing models provide their own unit and space to the individuals, so they are living somewhat independently, and the thought is that because they're able to stay there up to 24 months, they're developing independent living skills, so that when they do transition out of that program into permanent housing, they're able to do so without any supports. The other requirement associated with this funding opportunity that isn't highlighted in this is really this push for like self-sufficiency. And at the end of the transitional housing program, what HUD wants to see is that people exit to permanent housing with no supports from any mainstream benefits or traditional state or federal supportive services that communities tend to.
So this looks like that missing piece from congregate housing possibly, or somebody who's unhoused, to a permanent supportive housing space, because it would be sort of that missing middle, right, where you're teaching and helping support somebody to become more self-sufficient, more independent, more self-reliant. So it looks like a great model for like some of the small-scale housing discussions we've had here at the commission, because that is that missing middle that we've been talking about.
It could be potentially, but people who exit transitional housing should not be entering permanent supportive housing under this program model. People who go into transitional housing would be ineligible to go into permanent supportive housing moving forward.
Okay. So they would be going into just housing that's available out there in the market.
That they can afford by themselves with no additional subsidies.
So this is not to the exclusion of small-scale housing model. Okay, so it would incorporate that.
The other thing I'll say is our navigation centers and our emergency shelters do not qualify as transitional housing, so we can't leverage this funding to help subsidize those costs. Transitional housing has essentially always been an eligible category through the COC, but HUD for quite some time has indicated that it will essentially not fund it if you apply for it. The transitional housing, if you're trying to think of an example here in our community, the OC Rescue Mission runs transitional housing. They're probably our biggest stakeholder of transitional housing, and they do great work at the Rescue Mission. But as I'd imagine, as people were listening to Zulima, you realize that that particular intervention is helpful to a very specific and unique population. And by no means are we in a position to turn down any solutions at this point, but I think essentially the funding that we will be sort of swapping out for transitional housing will be funding that went towards and helped people who have already conquered homelessness and are in permanent supportive housing right now, helping them pay their rent and be provided services. So the COC community will really have to explore how do we prevent those folks from falling into homelessness once those resources are gone. And the last thing I'll say is those people that I'm mentioning are all individuals that have some significant disability, and many of them are also aging, older folks. So, at times you could think, oh, well, they've been in permanent supportive housing for a while. They should be able to phase out at this point. So I'm sure they found a job or something to that nature. That's not the case just by the nature of how this category is defined. These are people with significant disabling conditions that really need that support, that aren't able to really enter the workforce or increase their income. So those are some of the concerns we're dealing with at the moment.
Yes. Commissioner Shinagawa. I'm going to get this
Thank
right
you.
one of these days.
Hey, Doug, can you explain more the significance of tier 1 funding versus tier 2 funding? Because I understand tier 1 is better to have because you feel more secure in that funding level, but why would you feel insecure about tier 2? Like, how can they claw it back? Why is it not so secure?
That's a good question. So this is where it gets a little tricky. So here in Orange County, we have, I think it's like 21 or 22 programs that have, or grantees, HUD grantees, that receive funding through this route. All of those programs have direct relationships with HUD, and the funding goes from them to the organization, like Mercy House, for example. But every year, the way that HUD has defined how they were going to renew these grants, all 20 of those 20 plus grants have to apply through their local COC, through local competitive process, and then through that, the next step is that local COC, their collaborative applicant, which is us, puts one big application up to HUD saying, these are our 20 programs. And what HUD essentially says is, you have $38 million from last year. 60% of that funding is you put into tier 1. And then 40% of it you put into tier 2. So you rank your programs from best to worst, and those bottom ones go into tier 2. What happens then is when we as a community apply up to HUD through our collective collaborative application, HUD gives our community a specific score on how good our application is. So then after you get through tier 1, and there's a lot more to it, but for tier 2, HUD essentially starts funding you through your score. So if your community score is much lower than other community scores throughout the country, that funding's really at risk. What's added an additional layer is that HUD has made like significant, it used to be as easy as I just mentioned or as basic as I just mentioned. This year, they're gonna fund tier 1, and then there's like 4 or 5 other filters that happen through tier 2. So if you're like, for example, a tier 2 permanent housing project, you're at the lowest of the rung because they're prioritizing, like, what's the top one? Yeah, like they're looking in your tier 2 for transitional housing. So it gets really tricky. Essentially, your project is at significant risk of losing funding. Yeah. Exactly. You're talking about 30% of your funding and programming and people you help being at risk when they weren't previously.
Yes, Commissioner Spitzer.
Thank you, Madam Chair. What's the expectation of collaboration with law enforcement? Is that like grants pass enforcement? What is it?
So it's essentially, and there's significant language throughout it, is ensuring that you're cooperating with law enforcement around drug enforcement and encampment enforcement. That's, I think, in our community, the one probably on the lower list of worries, because I think we do an excellent job here in our community working with law enforcement. We have our local ordinance. I know that some cities have their local ordinance. We have an internal county policy that speaks specifically to how not only we have our ordinance, but how we coordinate through our supportive services and other departments to ensure that we are participating with law enforcement in the right way. So,
Doug, is funding associated with that?
Funding is not directly associated with it, but if we do not meet their standards, our score is lower, and we might not meet certain thresholds, which will then indirectly make our funding at risk, if that makes sense. So there's not like, if you check this box, you get X amount of money. It's all part of our application, and it would make us much weaker.
Are we going to have any future conversations with, say, the Chiefs and Sheriffs Association and our representatives about what that should look like? So that's a balance, right? Mm-hmm. Yeah, over-enforcement, trying to arrest people out of homelessness, we all, I think, agree. That don't work. That's been tried for years. So shouldn't we kind of have additional conversations about what this is going to look like?
Yes. Has the application come out yet? So the actual application hasn't come out yet. So we understand what the expectations are, but we don't know the question we will be asked. So we don't know what exactly we'll have to provide to prove that. I think the conversations you're talking about are ones that we will want to have, and also ones that we want to have outside of that, of this exercise, regardless of this exercise as well, because we know the importance between the relationship of law enforcement and the homeless service system. The other conversation that I think has to happen for this funding sooner than later is us working with Dr. Kelly and her healthcare agency to ensure that we are articulating all of the behavioral health services that we provide here in Orange County and how they are and will be available to the folks that are benefiting from these programs. So there's a lot of coordination here, and we know, and not to speak for Dr. Kelly, that resources are limited across the board. So it very closely, the language in the NOFO closely mirrors the executive order that came out in, I believe, late July of 2025 that spoke about expectations around like law and order and from the president. So long story short, I feel pretty comfortable in where we're at in compliance for the COC NOFO. That does not mean that there's not a lot more coordination that needs to happen.
Thank you, Doug. Do any other commissioners have any comments? Anything from our chair of the COC? Or are you still trying to dive into this and figure it all out?
Yes, to all of it. I think this is a good time to just appreciate the staff of the OCC. They've been working really hard to not just analyze and digest this particular NOFO, but 3 NOFOs dropped at the exact same time. And so they're working diligently to make sure that we have the right strategy to be able to secure the funding while also helping providers transition to what's needed, and hopefully to the benefit of our unhoused neighbors to be able to serve them. I think I just wanted to comment on the law enforcement partnership, because every NOFO has had some requirement for a partnership of sorts. And so prior to this, we were doing more partnership with healthcare partners. And many of those were being negotiated by the individual applicants and then being rolled into a larger application. So there is a portion of the requirement that's each entity that's applying also has to explain their partnership. So it's multi-layered, which I think makes it more complicated for the county team to get everything organized, and it's a really quick turnaround. And so again, just want to appreciate all the work that's gone into that. And on the COC front, what we're really looking at is how do we put the best and strongest application forward, and how do we continuously look at how the COC scores in comparison to other COCs across the nation, so that when we are looking at Tier 2 funding, hopefully we're competitive enough from a performance perspective, not just an application perspective.
Thank you, Commissioner. Any other comments? Okay, I'm mostly nervous for our neighbors experiencing homelessness with mental health disabilities. This scares me a little bit, knowing that we are not even a year occupied to our first permanent supportive housing unit apartment building, and it takes a while for these folks to be able to stabilize. And so I'm concerned that we're going to lose funding and exit people back into homelessness that are not healthy to go out there. So welcome again, Commissioner Lodby. We actually need you as part of this. So welcome to your first meeting again. Okay, Madam Clerk, will you please read the next item?
Item 2 is the Office of Care Coordination update, which includes updates on the 2026 point-in-time count, the OC Same-Day Solutions Fair, the Homeless Prevention Framework Project, encampment resolution funding, and the Emergency Shelter Operations and Services request for proposal. And we have no requests from the public to speak on this item.
Great, thank you, Madam Clerk. And I'd like to echo thank you to the staff for always working so hard. There's a lot here that Doug's going to update us on, but we will give you our full attention again. Doug, thank you.
Thank you, guys. So no breaking news here, I hope. Many of you, if not all of you, are aware that 2026 point-in-time count results were released early last month. So I'm going to give a really brief overview of the results here, and that's because we are planning, and we have a date that I'm able to announce today for the first time, for a joint meeting between this commission and the COC board that will allow us to A, dive deeper into the results, and B, which is much more important, hear from both groups on what they see in the results. How did we get here, their interpretation of that, and then arguably more important, what do we have to do from here? What do these results tell us? What are our marching orders moving forward to ensure that we continue to see great success? That meeting, and we'll send out invitations in the very near future, is going to be July 21st from 2 to 4 over in our county conference center, which is our old home across the way, because it can accommodate many more people. It's also a meeting that's open to the public. I think we anticipate having a good amount of stakeholders outside of the commission and the COC to come as well, and we're really encouraged about what that discussion will look like. So the brief highlights that I would like to mention, and I think are really incredibly important here, is first off, the 2026 point-in-time count followed the U.S. HUD's guidelines, which provide specific data points to be collected. This particular count was the fourth time Orange County utilized the same methodology, allowing us for an apples to apples comparison over the last 4 years. This methodology, specifically looking at the unsheltered population, is a simple canvassing of our entire county with ArcGIS maps and mobile surveying. So speaking of that sort of apples to apples comparison over the last 4 years, so many of you are aware that compared to 2024, we saw an overall reduction of 13.7%. When you compare that to over the last 7 years from 2019, we still see an 8% reduction. So as you can see here on the table all the way to the right, as many of you have been in this space for a while, we've really been going up and down over the last 4 point-in-time counts. But what we can see, hopefully through a trend, is that even through that up and down, as you look from the start, 2019, to now, we're still at an 8% reduction. Our unsheltered homelessness is down 27% from the last year, and then the last years, and then comparing that to 4 years ago, 7 years ago, we're down 23% over the last 7 years. So we're seeing some sustained success and impact, which is, I think many of us agree, would be largely due to the efforts through building and sustaining a comprehensive homeless service system. We see over the last 7 years, we also see a slight increase in sheltered homelessness over the last 7 years, which obviously any increase in homelessness you're not completely interested in, but when it comes to sheltered, that's really more of a reflection of the increased capacity that has been brought on board over the last 7 years. So we see that as a positive. As we look regionally at the data, we see success across all 3 service planning areas, 10% reduction in the North Service Planning Area, 15% reduction in the Central Service Planning Area, and a 21% reduction in the South Service Planning Area. All those percentages are in regards to changes over the last 2 years. So that 13%, 14% reduction overall is spread throughout our county. And then briefly, the really high takeaway points for us as an Office of Care Coordination is one is this is the first time our county's ever had more people experiencing homelessness in our shelters than compared to on the street. And this is a sign of how impactful our commitments to building shelter and serving people across our county is. It's also a reflection of the population itself, specifically demonstrating that if there are resources and shelter made available to folks, in very large part, folks accept them. This is through all of our surveys, all of our engagement with people, we continue to come across evidence that really bucks the myth that people who are experiencing homelessness want to experience homelessness and aren't interested in services. So we really see this as one of our key takeaways. The targeted prioritization and outreach efforts are increasing shelter access for highly vulnerable populations. So as we'll see in the data in a month, chronic homelessness and several different disabling conditions are increasing in our shelter and decreasing on our streets, meaning, the limited resources that we do have in our community, we've always focused on helping those that are most vulnerable. And what we're seeing in this point in time count specifically is that we're actually doing what we have set out to do, which is prioritize our resources for the most vulnerable. And then lastly, there still remains a tremendous amount of work to be done. We have over 6,000 folks that are still experiencing homelessness. And one of the things I really try to emphasize with any point in time count is that the 2026 point in time count results are a reflection of a countless number of factors playing into those numbers. And many of those factors are things that have happened over several years ago, meaning it's so important that we as a system continue to invest in our system, invest in our policies, and understand that policy decisions and high-level budget decisions not only have an impact in the near term, but really impact us long term. And then lastly, I just want to thank, it's really important to thank a whole bunch of groups that participated. Anyone who participates in the point in time count understands that this is an effort that is one that is only done through the whole community pitching in. Obviously, the County of Orange, us as a county has dedicated not only our COC resources, but many of our resources, whether it's through the Sheriff's Department, our Public Information Office, our healthcare agency, a variety of different commitments, our COC board and their leadership. CalOptima Health has provided significant funding in order to ensure that we are able to execute the point in time count the right way. CityNet as our project lead, who's been doing this for 4 consecutive point in time counts, are really experts in the field. We're lucky to have them. The Institute for Urban Initiative, a smaller TA group that really just works behind the scenes with us, are sort of everyday heroes that help us ensure that we're in compliance and aware of what's going on throughout the country when it comes to point-in-time counts. And then I'll mention, obviously, our Board of Supervisors is a huge supporting group. United Way has provided resources and volunteers, and then all of our cities and law enforcement agencies. So I missed a whole bunch of groups, but it's important that we do our best to recognize them, because although our office leads it, there are so many groups that we stand in partnership with in order to and rely on to have a successful event. My next update is on, please, oh, sorry. Yeah, I guess, do you mind if I take it? No, Commissioner Santabab has, so maybe I'll take a pause on this one.
Commissioner Morris. Yes, that'd be great.
I would like your comments on the senior homelessness increase.
we saw, so we track, in the point in time count, we track really 4 really important subpopulations: veterans, transition-age youth, seniors, and families. 3 out of the 4 of those subpopulations see their numbers going in the right direction. What Commissioner Morris is highlighting is that one group where we're seeing an increase. We saw a subtle increase of 1% overall, an increase of 1% in regards to the number of seniors experiencing homelessness compared to 2024. That 1% increase is comparing the 2024 senior number to the 2026 senior number, and that's a 1% increase. The reason I mention that is that's a 1% increase, but then when you consider the decrease we've seen overall, we see an even larger percentage of the overall population being represented by seniors in this count. The one encouraging data point when it comes to our senior numbers is we saw a 13% reduction in seniors experiencing homelessness on the street. We saw a 14% increase in the number of seniors experiencing homelessness in our shelters. There's the good and the bad with that. The good is that our shelters, yet again, are serving people, seniors 62 and over. We are focused on them. The frustrating part is that people are aging in those shelters because it's, there are less and less housing opportunities available in our system compared to our previous years. The one note that I'll mention, we really highlighted 2 years ago the bottleneck that we see in shelter as people are working towards permanent housing. There are so many, an overwhelming majority of the folks in our shelter have done everything they need to do in order to accept housing. That housing opportunity is just not there for them at the moment. That's what I emphasized 2 years ago. Even though we're seeing a decrease in our number, that bottleneck continues to persist and be a real challenge. So I hope that.
Will the Office of Care Coordination have a plan to counter the increase in senior?
Well, I think that's,
Or recommendations?
Yeah, there are recommendations. To me, when I hear that, I think more about like funding priorities. So obviously our office has funding around HAP and some other, I don't want to make it sound like we have more than we do, but some fairly discretionary funds, state funds, although they're coming with more and more restrictions. The COC, as you're very well aware of, has HAP funds as well, and I think that's where the largest priority is. And then there is significant work happening at the county level around aging in general. That happens. We are part of it, but we do not lead. Our office is a part of it. We do not lead it, but our colleagues in the Community Resources Department and Social Service Agency work together to provide resources to seniors across the board, but are also very aware of and highlight the needs for seniors who are experiencing homelessness or are at risk of homelessness.
Thank you both for your comments. Is there any other comments on the point in time count? I personally want to celebrate a little bit. Having a nearly 14% decrease overall is something to celebrate. We are doing something in the right direction. Obviously, I don't like that seniors are on the rise still, Commissioner Morris. This is something that I worry about is the bottleneck to in shelter. So again, I know that Commissioner Sarmiento and I have this same dream of small scale housing villages. Maybe we can figure that out this year and try to get people into housing instead of leaving them in congregate shelter. Yes, Commissioner. Rios Faust.
I just want to encourage everybody who can participate in the joint meeting to do so. The COC is charged with making sure there is a point in time count to report up to HUD. However, it's only as effective as our conversations and how we use the data, because it is a marker in a year or a 2-year span. It's not necessarily, it doesn't speak to the whole narrative that is our unhoused population. And so it's really an important conversation for us to have so that we can improve our strategies and our system response. So I really hope to see you all at the 21st.
I second that. Doug, same day solutions fair.
All right, so I'll do my best to be expedient here. So the Same Day Solutions Fair is we bring up every month. We're really excited, or every meeting. A couple of things. As you see here on the slide, let's see, there we go. We've had a handful of ones since we last met. We had a meeting. Our most recent one was May 13th at the Hub here in Orange, which we're doing every other month. And then we had a Same-Day Solutions Fair in the city of Costa Mesa. I think it was like a day or two before our April meeting. We're really excited that next Thursday, the 25th, we will be having our next Same-Day Solutions Fair down in the city of San Juan Capistrano at their community center. This will be our most southerly one. The city of San Juan Capistrano has been a good partner on so many fronts, so we're excited to partner with them on this. This will be the first one we do that will be strictly indoors, which is great because, you know, June 25th, we could expect the weather to be really hot. I've gotten plenty of sunburns at these things, so it'll be nice to not get a sunburn. So we're excited about that. The other piece that I want to mention, you'll see in your packet, we have essentially some mid-year summary reporting. So as we've always mentioned, we've on top of operating these things, we want to measure impact, and we're trying to improve our ability to do that day in and day out. We have a new report to share here. This shows some of the really high-level data from the 4 we've had in the calendar year of 2026. So 839 participants across those 4 events, 43 unique providers showing up. You can see we had 29, 34, 21, 29. These events are rich in resources and services, almost 3,000 different services provided. And then we've received a good amount of surveys that we really utilize to continue to improve upon the event. A lot of folks are, stating satisfaction at high levels on a score of 1 to 5. We're very close to that 5. And then I like the chart on the bottom, just as sort of the administrator of this event, to see the different resources, each particular resource and how they were utilized, some of our top resources. And what you'll see is blue is Placentia, green is Costa Mesa, orange is the orange event in March, and the more yellowish is the orange date in May. What we're seeing and why doing these every month is important is that some months certain vendors are available and other months other vendors are available. So, especially when we were doing them once every 3 months, if there was, for example, the DMV wasn't able to make it one particular event, folks were really disappointed, and it's a lot harder to say, don't worry, we'll see it in 3 months, compared to, don't worry, they'll be here next month. So, peruse at your liking. Next, I want to continue to highlight that the Office of Care Coordination has contracted with Cooperation for Supportive Housing to develop recommendations for a comprehensive homeless prevention recommendations rooted in best practice that ensure proactive utilization of all our homeless prevention resources. Basically, we've contracted with the Corporation for Supportive Housing over the last 4 to 6 months to help us do a couple of things. Better inventory all of the prevention resources in Orange County, not just ones operated by the county, but other resources, to provide somewhat of an easy tool in order for us and the general community to be able to utilize in order to know the exact resource that would apply for them or the person they're trying to refer, because homeless prevention has many different forms to it, and depending on your or your household's situation, different resources are obviously more applicable than others. And then lastly, what I think I'm most excited about, and I didn't know as we entered this journey what it would look like, but now I'm increasingly more excited, is this group has gotten together many local stakeholders. Many of you in the room have participated in doing not only surveys for us, but focus groups, and are a part of an ongoing focus group that is really helping us not only understand what we have, but highlighting some of the areas where us as a community can improve in regards to prevention. Obviously, funding comes up quite often, and there's limited impact to that, but the discussion hasn't been limited to funding, because in many ways that would be a dead end. But we've been talking a lot about different things, specifically around coordination and then outreach to households. If you all remember the 2025 survey, where we've surveyed 800 folks on the street about their journey into homelessness, only 12% of the respondents said they looked for help before they entered homelessness. So to us, I think that means that they weren't aware of the resources that were out there. So this group is really thinking about ways to better outreach. One example is this homeless service system. We've got to work in a more coordinated way with our schools, not just with our McKinney-Vento liaisons, but with our school districts as a whole. So more to come here. I'm really excited about that. This commission, especially when Commissioner Sarmiento was the chair, really highlighted the importance of prevention, and this is one of those efforts that have spawned off from those. Moving on to encampment resolution funding. So this is arguably an exciting update here. So the governor, about 5 years ago, created a funding stream called encampment resolution funding that provides communities with funding to address specific encampments in their community. During the pilot funding round, our community received a little over $3 million to address Talbert Park in the city of Costa Mesa. We reported on that over the years here at this commission. The city of Garden Grove received funding to address the 22 Freeway and Beach Boulevard encampments. We've applied for different rounds. The challenge is that the funding really looks to fund communities with larger encampment issues than us, the way it's, because we don't have, fortunately, large encampments anymore, like the Riverbed or the Civic Center. It makes it a little bit more difficult for us to leverage. A fifth round of funding is now open for applying to, and our office is working with the city of La Habra, I'm sorry, around a specific encampment, mainly on the Union Pacific Railway property that has roughly 10 to 12 structures on it that's been there for quite a long time. A pretty regular population that's been there and been somewhat resistant to the resources they've been offered. The City of La Habra's outreach team has done a really good job creating relationships with them. We see this as an opportunity to work with the City of La Habra and leverage this funding to not only get more of an outreach focus on that area, but to get more resources around transitional and permanent housing that will hopefully entice those folks to come on in and end their homelessness. And then lastly, I just want to make everybody aware of a request for proposal that our office has open at the moment, seeking applicants for two different programs. Program A being emergency shelter operations and services for individuals, families, and survivors. And then Project B is emergency shelter operations specifically for transitioned aged youth. The application closes on July 8th at 5 p.m. Most of the funding that is funding this RFP is HAP dollars from our continuum of care. So this is, although, as the administrative entity, we are opening this RFP, the funding and sort of the oversight of this is coming from our continuum of care. But we know that many shelters here in Orange County, if not all of them, are having challenges with funding their operations year over year. This is an opportunity for a little bit of assistance, so we want to make sure that the word is spread high and far. And with that, I'll pass it back to the chair.
Thank you, Doug. That was a great update. I would like to commend the county and any people in this room that have been participating in the same-day fare solutions. I think this was a great program for you to put together. I'm glad that it's every month. I want to give a shout out here to my fellow Elks at the Orange Elks Lodge. I'd love to know what services they provided. They actually posted on our page. We're at the Hub OC, so it must have been something with that.
Yeah, they provided food and I think clothing, and they came out strongly.
That's
it's
great.
Awesome.
Yes. Elks Care, Elks Share, Elks Care. How is that?
Well,
Yes.
it's a reminder of, like, you know, a lot of these resources on here are like traditional ones that, like, if I told you to name some, you'd be able to name. But what we've seen through the Same Day Solutions Fair is we also get these unique partnerships that for not this event, that group would not be engaged in this particular way. And that Elks Lodge is a great example of that.
That's great. That's great. We have a very active membership. Do any other commissioners have any comments or questions about anything that Doug reported on? Okay, seeing none. Clerk, will you please read the next item?
Item 3 is the 2026 Commissioner Objectives, and we have no requests from the public to speak on this item.
Thank you, Madam Clerk. So at our last meeting, I had all of you share your objectives for 2026. I thought it was a really great conversation. Everybody actually surprised me by the input that you gave. It was very heartfelt, and I know that we really want to be able to come together as a team and find the right solutions to really bring some recommendations up to the board. I'm excited to have our joint meeting with the COC, and I really think that we can continue to bring thoughtful discussions into the 4 pillar areas. And when I was reviewing the feedback, there were several common themes that actually emerged, and the team helped me put this together. Thank you, Julie. I know you guys are really involved in putting that stuff together, and I appreciate it. But it was around the importance of collaboration, coordination, and communication across our homeless response system, as well as identifying ways to reduce barriers that make it difficult for individuals and families to access programs and services. Given the consistency of these themes across the commission, one potential next step may be the formation of ad hoc committees that we could take a deeper look into each of these areas and bring recommendations back to the full commission for consideration. However, before we commit to any specific approach, I would like to open up the conversation to hear your thoughts on the discussion and hear what other opportunities commissioners might see for advancing the objectives we heard during our last meeting. And the theme, again, that really came out was coordinating. How do we coordinate better with each other? How do we collaborate better with each other? Obviously, bringing in this joint meeting with the COC is one way that we can collaborate and open up communication. But what are some other ways that we can look at our different pillars, from prevention to outreach to supportive services to shelter and to housing? Clearly, I sit in the housing seat, and so for me, I know that my biggest solution that I am dedicated to is to provide housing for people. And knowing that people are stuck in our shelter system and that there is a risk for our neighbors that are dealing with mental health disabilities, I'm a little bit more nervous about that pillar and making sure that we can provide that. So I'd like to open this up to our commissioners. And Commissioner Spitzer, I don't believe you were here for that meeting 2 months ago. I asked every commissioner, out of the 4 pillars, why are you here? What's your important why that you're sitting in the room? And what would you like to see us dive into a little bit deeper? So I'm going to call on you first.
Could you give me a heads up? So I'll just dovetail on the comment about the coordination with law enforcement. I don't want to go back to a model where we're just arresting people and throwing them in jail. And I know Sheriff Barnes and I and the chiefs are committed to not doing that. But I also know that this administration and the funding mechanism is not going to allow communities that all of us are seeing on the news at night, especially with the election in Los Angeles and the run for mayor. I'm seeing all these commercials of what LA looks like. And look, for a long time, I mean, when we built Kramer Place when I was on the Board of Supervisors, that's been my whole mantra. And some people are offended by what I say is I don't want Orange County to be Los Angeles. I mean, it's got some great attributes. I grew up there, okay, and I went to school there. But we do look different, and I'm going to fight hard to protect it. But it doesn't mean because I'm committed to the public safety side that I'm also not committed to housing people and giving them the skill set to be able to be self-sufficient, right? Which is why we staff the same day fare, is because we're there clearing people's records. Which, people's pending criminal cases and warrants is a huge inhibitor to their being able to get services and, moving on with their lives. So I'm a little concerned, especially because somebody mentioned, I think it was Zalima, that there's going to be a very short window from the application to the closing and the submission. If we don't advance some of these conversations with these new prescriptions, these new potential criteria, even though we're not necessarily certain exactly what they're going to look like, we probably have a pretty good idea, or we have relationships with people who could give us some insight about the kinds of conversations we should be having now so that we don't lose time. If we have to have a significant law enforcement component, I just want to make sure, while we can enforce grants pass and we have a lot more tools available to not allow for encampments, I just don't want to go backwards. And the thing about the point in time count is, I worry a little bit about the successes because it takes the issue off the general public's radar. So if they see, oh yeah, homeless is pretty manageable here in Orange County, we have to keep this issue at the forefront because I don't want to lose our county community's support of us all working together to keep this kind of standard we've established for ourselves in this county. I hope that makes sense.
That was great. Thank you for letting me call on you without warning. I appreciate it. Something you said kind of resonated with me, though, thinking about how we wanted to come together and maybe look at more ad hocs, diving deep into those pieces into the NOFO that we would walk out of this room and not think about for another 2 months, but we need to think about, and you're correct, Commissioner Spitzer, maybe we need to have law enforcement in this room come together a little bit closer and talk about those things. What are we going to be expected to do? Or what does transitional housing look like? As I recall, many years ago, HUD said that didn't work anymore, and so go to housing first, so now we have to switch back. So for those of us in the housing space or services space for people that are in housing, how do we switch that all of a sudden? And what should we be doing to help make our application a lot stronger to make sure that we don't lose funding, especially in that Tier 2 section? So just wanted to throw that out and see if there was any other thoughts from our commissioners on things that we could get together in smaller groups and really dive in deeper, especially in the next couple of months as this is coming out, and really help get that application well written. Commissioner Rios-Faust.
Just wanted to share, the COC, since the NOFO comes through, the COC has already formed a NOFO ad hoc to be focused on the application itself and these key parts. I think what you're raising, though, is the opportunity to, when we look at these NOFOs, to consider inviting a member of the commission to potentially be part of the ad hoc and for future opportunities, but that ad hocs are normally for the NOFO specific, and the COC specific tasks are formed by the COC, and that's been formed already. But again, that's an opportunity to bring back some information and just communicate between both bodies, since there's overlap there's definitely a mutual goal and there's overlap in some key functions, but also don't want to duplicate efforts in this process.
Thank you. I appreciate that. Yes, Commissioner Trujillo.
Hi, just have and I mean this in no disrespect towards anybody, you know what I mean? But is there going to be like a time frame, you know, because we can talk about this all day long in these meetings, and then we see each other in another couple months, and then another couple of months, and then a year passes by, and then we got to get permission from 5 Checkpoint Charlies, you know, to get things going. Is there going to be a time frame to actually start doing something, or are we just going to keep talking about this?
That's a great question. You want to take that one, Doug?
Thank you, Supervisor. First, say welcome to county government, Commissioner Trejo. You know, that's if we didn't have those checkpoints, why would we be here? No. All kidding aside, I think the vision that we had talked about prior to this meeting was technically an ad hoc needs to be time limited. It can't be a committee, so to get the technical jargon out. But we were thinking about these ad hocs maybe lasting 2 to 3 meetings, each of them. So really looking at the first meeting being focused on identifying where some of those gaps are. And then the second half of the meetings, whether we needed an additional meeting to talk about that, would be each of the commissioners who are in those ad hocs, who are most likely their principal roles live within the ad hoc. So like the chair said, she's focused on housing, she'd be in the housing ad hoc, really speaking about what they can do in their principal roles to contribute towards closing some of those gaps. We're not looking for gigantic systemic impacts, but things that we can do. So to that point, I think that the goal would be that the commission would come back in the later half of this year. I mean, one of the challenges is that we meet only once every 2 months. But in the later half of this year to talk about how each, A, what those ad hocs had talked about, but B, what each commissioner is doing or is going to do with the support of the members in the room to really, do something in those areas.
Yes, Vice Chair.
Could you, I'm hearing a couple different conversations. I'd just like a little clarity. I think there's a little question about the continuum of care, or the COC NOFA that you're talking about, and then this commission objective track that I think you're talking about. I think there's two conversations going. Correct me if I'm wrong. I think you're maybe touching on the time frame to respond to the NOFA. Am I right, Commissioner?
I was touching more like on, Mr. Spitzer, he's talking about maybe bringing some law enforcement, and get
Right.
to work together, right? If we're talking about working together and really just trying to solve homelessness in Orange County, I understand that there's county rules, no disrespect, I'm a mover and a shaker, If you told me, hey, Anthony, we need to go find some housing units, I'm going to get on that tomorrow. But to sit here and just continue to go, round and round, how are we going to solve homelessness in Orange County? You know what I mean? We got to think outside the box, because what we've been doing is not working. That's just the honest truth. If we're depending on vouchers and, for everybody that's in the shelter, we're going about it the wrong way because not everybody needs a voucher that's in the shelter. So how do we get more creative? So that's kind of what I'm just trying to touch on, If we're going to bring law enforcement in here to collaborate, let's do it. Let's set that up. Let's set a time frame. If we're going to get to know one another more and more, what's out there, let's set a time frame for that. That's just my frustration, and just seems like it's going on 6 months for me here, and what have we accomplished?
I think, yes. Well, I think Commissioner Sarmiento wanted.
Please, sir.
You want to go next? Okay. Thank you.
Okay. Well, first off, thank you for bringing this up, and Commissioner Trejo, thanks for pushing this along. And again, I think that you bring up a very valid point, and that in this mixed group, we all have our strengths, but we all, I'm a pre-hospital guy, I'm a hospital person, I can't talk housing. So I can ask questions that you guys have probably already discussed and maybe have some creative answers to that may slow the conversation down. So I actually think that the idea of the ad hoc groups in the key pillar domains makes a lot of sense, because my partner's pre-hospital and in the support area, we know where those touch points are, and we can probably come up with some key questions to bring back to the commission very quickly that then the commission can leverage in a legislative, effort. And we already have examples of that. So again, I won't take too much time, but I know that there's already the Care Plus program that the Outreach Engagement Office is working through, and there's the Compass OC system that tries to integrate a lot of the information sharing. But I know for myself and for the pre-hospital and some of the documentation and notifications, there are ways that you can create alerts within the system that already exists that I don't have any access to, and I have no way to get that information from. Maybe that's something we can talk about in an ad hoc group between this commission and, integrating with like OC Meds, and how do we share where those barriers are and get right to the point so that we can be efficient with our time and bring something back to the commission for success. That's all I have. Thank you.
Oh, that's great. Thank you. Commissioner Sarmiento.
Yes, thank you, Madam Chair. I thought you were going to ask me that question. Why am I here? See, only Commissioner Spitzer saw that or heard that question. But look, I think what it does is, it makes us, because I think I wasn't here, but Vasila was here in my seat and kind of shared my thoughts about prevention. But just to sort of reiterate that, I certainly believe in the prevention pillar, as I do the other three. But that one, to me, has played a role in affecting the point-in-time results that we saw. I believe that, the more we try to keep people or prevent people from becoming unhoused, it closes that door, or at least narrows that door for people becoming homeless. So continue to believe in that. I think as we see the new funding requirements or new criteria from HUD, when it comes to going back to transitional housing, looking at law enforcement and how their role is going to be, I think it's how we roll it out, right? I think that we know law enforcement has to play an important role in making sure we address things like the encampment resolution funding and other efforts. It's how we see how we do it more effectively. I think it has to be done with staff, some of our outreach and engagement team that are professionals that can address people who are unhoused and not necessarily just cite them, apprehend them or arrest them. But there are ways that we know are more effective, and we've been studying that. So, to Commissioner Trejo's question, look, it's the frustration about, I think, everybody in the community is not just the time, but it's the money being expended as well, to make sure that the money is being used cost effectively. So if you're trying to prevent somebody from being unhoused, you're spending a lot less money than finding somebody who's unhoused and trying to house them after the fact. So those are ways that we can do. And really the ad hoc system, which I think was proposed, is a good one because it does accelerate the timeline. It may not seem that way, but when you have a group of commissioners or any subset of a body and they propose something, then the larger board should address it, and then this as an advisory commission should send it up to the Board of Supervisors. That's logically the way it's supposed to work, and it has worked with the stabilization and prevention program that we stood up. I'm hoping we can do the same with small-scale housing, because trying to develop permanent housing, brick and mortar traditional housing, takes close to 2 years and close to $1 million a unit. So that just is not a feasible plan. But if we can look at ways to introduce, again, small-scale developments, and I'm glad Madam CEO Aguirre is here, because the county has to have some skin in this game, and we have some remnant parcels that we should be activating for that. And if we can stand something like that up, then we can demonstrate a proven successful example, and other communities, I believe, will want to stand theirs up as well, because that's how we worked sort of the bed placement navigation centers, is once you do it successfully, others start realizing that it doesn't have the secondary impacts everybody thinks are going to be harmful to their community.
Yes, thank you, Commissioner. Yes.
Thank you, Chair. Your comment is exactly why you're here. And I feel your frustration, because I have it every day too. And occasionally Doug gets a text or a Teams from me in the morning on my drive into work because I see a homeless individual that is lying on the ground. They've slept there all night. Who knows, right? The most recent one was this week, right in front of St. Joseph Hospital, right? I'm like, what the, really? NIMBY and money, right? Two of the things, I would say we don't like talk about it all the time, right? But when we talk about things like the small scale housing, it's like, who's going to pay for it? Where is it going to be? Whose backyard is it going to be in? I'm dealing with an issue right now, right, of NIMBY. And I think the smaller group, the point of that is we're tackling it, I would say slower than I think anybody would like, but within the restrictions, the requirements, the rules, all of that. And so as we come up with creative solutions, we're implementing them. I met with Doug and Zulima and Karen earlier today, and we rolled out our wrapped outreach and engagement vehicles, and I don't know if anybody's seen those yet, but when the O&E team went from HCA to CEO, one of the things that we did is we rebranded them. And so they are out in vehicles that are actually visible now to the public, to a homeless individual, right, that might be driving behind that vehicle, and we'll flag them down and let them know that they need assistance. And that is what has already happened, as reported to me by Doug and team. So we're going to do whatever we can, and within what we have the ability to do. But if we could break down those barriers, again, it's like the working together, and that's why you all are here. And that's the purpose of those smaller groups, is identify those gaps and then say, what are we going to go do about it? There's the police chief and sheriff association, right? They already meet, so they have the ability to communicate and talk. And I think you all do on a regular basis already. But it's I would say the politics of it all, right? So we're doing as much as we can, Commissioner, right, within that, but you're right, we've got a lot more work to do. And Chair, I appreciate being able to make those comments because I feel the frustration also, so thank you.
Thank you, Michelle.
I understand the money part, and I understand, the red tape, but there's so many other homes, there's so many other, programs in Orange County that I'm pretty sure most of you guys don't know about, but if we came together, every city and identified, hey, well, we have this home right here that's not county funded, we gave those tools to law enforcement where they don't got to depend on, taking clients to, Bridges or somewhere else. They can have those tools, even for our outreach workers, we give them the vital tools that, hey, there's other homes right here. Maybe that can make a little bit of impact, Another thing as well is there's such a turnover in case managers, in every agency. Why would anybody if I was in the streets and I got a case manager every month, why would I want to even try? Because there's such a turnover. So maybe we get all the outreach workers together. We rent a field or something. We bring everybody to get to know each other and put this on a spreadsheet so we know who has what. Because at the end of the day, I meet someone from CityNet every day, and it's like a new employee. I meet someone from his OC every day, it's a new employee. But how do we get to know each other on a regular basis, and at least twice, 3 times a month, so we're not running blind out there?
Thank you, Commissioner. Commissioner Vasquez.
Yes, I just want to highlight 2 things that we do positive in Santa Ana. Thank you to Supervisor Sarmiento that during he was Mayor Sarmiento, he brought ordinances. He brought the rent stabilization ordinance that capped a 3% raise in rent in Santa Ana, along with renters' rights. And many families have been protected, and they come to the city and they ask for that help, and that's kept many families in their homes and saved people from going onto the street. So we appreciate it. It'd be great to highlight it, especially now that Anaheim is trying to do the same, and other central cities who are trying to do that type of work that have saved our families, and we've been told that saved them when landlords are trying to raise rents by $500, $1,000. And that's really supported our residents in Santa Ana. And we have a lot of issues with families, the countywide, or statewide even, we're 17%. McKinney-Vento, those are kids are housing insecure, but my school is 30%. And I get a lot of feedback and conversation as we bring them up in classes. So this rent stabilization ordinance, thank you, Supervisor Sarmiento, for bringing it on. The other thing that he passed was the WHO, the Housing Opportunity Ordinance. And then we get in lieu fees. People, new developments have to build and incorporate affordable housing into their new structures, or they have an in lieu fee, and those monies support us with vouchers or help us build affordable housing or support affordable housing building in Santa Ana as well. So those are two things that we did well. Thank you again, Supervisor Sarmiento, for that work that has supported us, and I've seen it as things come through, the dais and the work that I've seen in Santa Ana.
Thank you, Commissioner Vasquez. Yes, Commissioner Foster.
I just wanted to jump in. I know a lot of law enforcement has been thrown out in this conversation. I represent the Orange County Chiefs and Sheriff. That's why I'm here, so I can bring back that message. I'm very confident that all of the chiefs in Orange County are committed and will continue to be committed to working to address homelessness. If you didn't know, not trying to be funny, we have literally the DA and we have Orange County Sheriffs right here. And they have been very creative over the last several years trying to combat this. We have the opportunity as a group to have these discussions, and that's why they sit on the board, so we don't have to necessarily delay. We can start making decisions now on how we want to address these things. So we have a great opportunity, and I look forward to bringing back your guys' message to the chiefs and sheriffs.
That's great. Thank you, Commissioner Foster.
Can I comment on that?
Yes, you can.
So what I'll add is that the commissioner is exactly right. Two things. This morning I was invited to the sheriffs and chiefs meeting to discuss point in time count further, which I mentioned that because I think it's an example of how engaged the law enforcement community is. And then I think to better answer the question about the NOFO really requires you to describe activities currently going on in your community. And that's why I do feel comfortable with where we are with the NOFO as an example of, yet again, where we're at with law enforcement and the partnership. Not that, all of us agree that there's always more and more work to do, but we are far, much further, fortunately, due to the leaders in this room and outside of this room, when it comes to our relationship with law enforcement and the homeless service community. So, yeah, I'm excited to speak with the chiefs and the sheriffs about the point in time count. That's going to evolve into a different direction as well, I'm sure. And then this ad hoc group will be an opportunity as well to leverage better ideas.
Thank you, Doug. So can I recommend that we break our 4 pillars into 4 ad hoc groups and that we have 2 meetings before our next meeting in essence, time is of the essence because people are living out on the streets and we don't want to continue to just talk about it. I agree with you, Commissioner Trujillo. And have some input when we come back in August. The first meeting will be about what should this ad hoc committee really focus on, or what are the parameters of it? I think we talked about that before. And then the next meeting before we meet again in August can be, what are some solutions we can come up with in each of these sections? Maybe we don't know everything because each of us kind of work in our own silo sometimes, and maybe we don't know everything that's out there or how we could collaborate better to be able to move something forward faster. So can I make that recommendation? Is that something I can do?
Yes. And I think the bylaws allow for the chair to essentially create ad hocs. The membership of each ad hoc is determined by the chair outside of this, outside of the meeting. So the creation of them doesn't mean we have to figure out who's in what. I know what we talked about, maybe the easiest way to move forward, assuming, we've got the ad hocs, the creation of those groups. Now the membership would be if each commissioner could reach out to our office, to myself or Julie and CC Zulima, to state which one of the ad hocs they'd like to be a part of. And then we could work with the chair to cement that membership, and then work on the meetings as well. The outreach and supportive services, the only suggestion that I might, I don't know if we want to make, I've always been sort of torn with outreach and supportive services being together, and that's sort of its own discussion, because supportive services really are the sort of mortar and support of all four pillars, and knowing that outreach and supportive services is sort of a wide umbrella, because I would say that includes traditional outreach teams, behavioral health resources, law enforcement resources. I don't know if we maybe want to, and obviously our staff is the one that's got to staff all these, so I'm a little nervous, but maybe do like an additional group, like a prevention, shelter, housing, an outreach one by itself, and a supportive services one.
You could also put shelter and housing together.
Yeah, so I guess.
Kind of the same.
Are we allowed, I think we're allowed to, we don't have to define each ad hoc at the very moment, but say that we'll have a collection of 4 or 5 ad hocs. I know that's, I'm sorry, thinking out loud here. I should have done prior to the meeting.
Typically, when an ad hoc is created at a meeting, you at least want to state what the ad hoc is, like what the ad hoc committee is, and then what its objective, and then so you don't have to say who's on it, but you should at least hammer out which ad hocs you're creating and what their objectives will be.
Then I guess if the chair is comfortable with this, maybe stating we will have a 4 or 5 ad hocs focused on each one of the pillars, provides a little bit of flexibility, focused on identifying identifying the areas of needed increased communication, collaboration, coordination, and reduction of barriers and programs in each one of those areas that the ad hoc will focus, each ad hoc will focus on, something like that. Are you okay with that? I'm sorry, Gina.
No, I'm comfortable with that. I need you to take the lead there, Doug. But I would put housing and shelter in the same ad hoc, though, because quite frankly, you're either sheltered or you're not. So I think that goes in its same vein. And that way you could break out outreach and supportive services, since they are 2 different things, and then leave prevention on its own.
Okay.
Yes, Commissioner Shinagawa.
That makes sense. However, I do have concern because the themes were about collaboration and coordination, and the pillars, though wonderful and important, right, they can be siloed in a way, right? So, how are you maintaining collaboration and coordination between those pillars, right? Because, should an ad hoc really be more about how can we coordinate services better between healthcare and law enforcement and how, right? Should it be across pillars rather than tied to a pillar? That's all.
He's throwing a wrench in there, Doug.
I
What do you do with
apologize.
that?
I guess I think there's so much work to be done within each pillar. Each pillar is so large that there's enough work to be done within them. And even as I think of this is where that supportive service pillar is so challenging, because I mentioned behavioral health, I mentioned law enforcement, I did not mention the hospital systems. But with those groups together, those are arguably 3 separate silos that would be in one ad hoc to sort of talk about the work amongst each other. And then potentially, I think, to answer your question specifically, one of the results of the ad hoc or next steps of the ad hoc would be, this is where we feel we need to be partnering with our fellow pillars. So, So, and yet again, coming up with solutions, but also talking about next steps of where the direction of where it needs to go as well.
Right, and taking those 3 C's as the theme. Who should we collaborate with? Who should we be communicating with? Okay. I like that. Thank you, everybody.
Okay, just for the record, I want to just make sure. So the creation of a prevention ad hoc, an outreach ad hoc, a supportive services ad hoc, a housing and shelter ad hoc with the purpose of returning to the commission in August with ideas for solutions and next steps. Anything else?
We would prefer that to be October. I'm hearing in my left ear over here.
October, okay.
Madam Chair, could I
We might
maybe
need a little more
add,
time. Yes.
maybe not bringing solutions, but I think of the ad hocs more of like an idea incubator, right? We have to dip into our specialties and our relationships to identify these gaps and then bring these gaps to where we can do something about it. At least that's what I had in my head. So I wouldn't go so far as solutions, but waypoints, milestones. Thanks.
Madam Clerk, do we need to pick a word? You've got that?
No, I just want to make sure that I state the purpose, the ad hocs and the purpose correctly, so.
Perfect. Thank you. Well, thank you, everybody. I think that was a really good discussion. Oh, who are we pointing at? Sorry, Commissioner Rios Faust.
Taking a lot of space today. Just as a maybe a help, something that I'm hoping would be helpful is I wonder if the officers of the COC could meet with the officers of the commission to identify opportunities for the COC representatives to do some education on what's happening at the COC and a couple of strategies, because I'm thinking fiscal mapping, our coordinated entry systems being evaluated, and a couple other pieces that then would be additive to the conversations that are going to happen in the other pillars. And I'm kind of committing the other chairs to be able to do that before August and hoping that doesn't add a layer of work to the team that already has to get the no fault. But I think that would help us make sure that we're additive and more comprehensive in our response versus duplicating. So I'm offering that as something we'd be willing to do.
I think that's a great idea. Vice Chair?
I concur.
Okay, great. Oh, yes, Commissioner Spitzer.
I literally have no idea what we're doing. No, I'm not trying to be a downer here. Look, when I studied for the SAT, I took a prep course to try to do better on the SAT. It didn't mean I was going to be better in college. It was just I needed to do well on the SAT. I want to do well on the NOFO. So I feel like we should have a goal, however we break up into groups, to figure out strategically how we excel in that application process. Because I want to get as many resources for our county as possible, and I have no understanding about the shift in the administrations, right? There's different priorities of this administration. So the rules of engagement and performance objectives have been changed from administration to administration. Some of us have invested for years in one approach. Now it sounds like, I don't really understand because I'm not that educated yet on it, there's a different approach. We have to pivot if we're going to be successful. So I would like to see this group have a goal of understanding the NOFO and figuring out how we can pivot to excel. Because I can't go into a group. I find it frustrating to speak in the abstract. What I think the ad hoc assignment is, let's try to be better at resolving homelessness and get more people into housing. That's kind of what I hear the assignment is. That might be all fine and dandy, but that's a long-term goal. And if we don't do well in the NOFO, we're not going to have the resources to do the goal, the objective. So to me, the short-term goal of our work should be trying to get as much money for our county as possible.
All right, thank you, Commissioner Spitzer. I'm sure you want to add in there too.
What?
I believe that's the role of the COC, and I'm pretty sure that the chair let us know that they already have subgroups within the COC working on those added layers to the expectations of the NOFO. My thought, even when you were speaking of that, Maricela, sorry, no, I'm not saying Commissioner, is there any room for other thought leaders in that space that might be able to, because clearly having law enforcement part of that conversation and other thought leaders might be an opportunity.
Not involved in that at all.
Right.
We have a board meeting next Wednesday where we'll be presenting on the NOFO, and it's a great opportunity to have you all come and participate, potentially make comments during that meeting, but that'll give you a thorough presentation on where we're at. It's on Wednesday from 2 to 5 p.m., but I'm sure we can at least communicate what time and where on the agenda it's intended to be, but that's a great opportunity for all of you to, if you can't be there and do not want to make a public comment, you could listen in to get educated on where, and a deeper dive on the NOFO, where we're at in the process, and what the intended next steps are, including what the ad hoc is. And then I just want to add that although we're talking about the 26 NOFO now, the team has done an excellent job of making sure that when we got news in 25 and 26, of staying on top of that and keeping people engaged throughout the process so that we could pivot and it wasn't a crisis or a reactive. We weren't reacting, but we were intentionally thinking about what those next steps are. And again, huge credit to the team that has kept the focus on that even as this litigation has gone on over for the 25 funds and the 26 funds. So while I don't think, right, like nothing's guaranteed and I don't think things are necessarily perfect, I do know progress has been made and has been made. And the best place to get that extra feedback and understanding of where we're at is going to be at next Wednesday's meeting. And then we can determine from there how to engage members of the commission on either the ad hocs or additional information that might be needed at that point.
Great, thank you.
Yeah, I would just reiterate that the COC NOFO, there is a large team, both between my team and the COC, which is a board of, I think, 21 members, and their teams working on that exercise. More thought leaders and participation would be great. Next Wednesday's meeting is going to focus on informing the COC board and any member in the audience of, what this application looks like for this particular funding. The ad hocs we envision being just, the COC NOFO is one specific targeted exercise. The ad hocs are just a larger, more community-wide exercise. There is a heavy emphasis on law enforcement. We'll know our information, but like I mentioned before, and I, there's always a danger in saying this, we feel pretty comfortable that our application will check off the right boxes for law enforcement requirements as we stand now. Do we want to continue to advance our efforts? Absolutely. But we believe strongly that what we're doing here in this community will achieve the purposes of the 2026 NOFO. I think it'll be really helpful and I think a great idea for COC leadership and commission leadership to meet in the next month or so. More folks to show up, maybe to next week's meeting would be helpful. Our office is happy to speak with any commissioner or their staffs about expectations. It'll become more crystal clear within hopefully the next couple of days if the federal government releases the actual application, which will tell us the questions we need to answer. So then we'll know the exact specifics of what we need in order to maximize our points as a community. Hopefully that helps.
Great, I think that is very helpful. So that meeting takes place in our former room from 2 to 5 next Wednesday on the 25th, is that correct? I think. It'd be great. Well, thank you, everybody. I appreciate your insights on that. I think we got that, got through that. And we can now move on to action items on our agenda. Madam Clerk, will you please read the next item?
Item 4 is a recommendation to approve the appointment of Aaron France, City Manager for Buena Park, as the North Service Planning Area Representative, to recommend to the Board of Supervisors for final appointment. And we have no request from the public to speak on this item.
That's great. Thank you to our membership ad hoc committee for supporting the recruitment of this seat and for working to review applications and to make this recommendation to the commission. I'll turn it over to Doug to provide more details.
I'll be quick. It's our membership ad hoc, who you see up here on the screen. Really appreciate their time and willingness to review applications. We've had a couple of rounds because it was difficult to get I think, a candidate that appropriately qualified. We're really, I know our office, but the membership ad hoc's excited to nominate Aaron Franz, City Manager of Buena Park. Does great work, not only for the City of Buena Park, but leads the North Orange County collaborative or task force and does just a really excellent job there. So, I think bringing him on board would not only provide the input of the City of Buena Park, but also the great collaborative work that happens up in the North Spot that, also Commissioner Forster brings from the law enforcement side as well.
That's great. We look forward to hopefully welcoming him to our group. Oh, do we have to vote? Oh, we vote. This is an action item. I'm back. How do I do that again?
Essentially.
Oh, thank you. That's it. All in favor?
Aye.
Any opposed? Any abstentions? Motion passes. Okay. Madam Clerk, will you please read the next item?
And item 5 is to approve the commission to address homelessness minutes from the April 15th, 2026 regular meeting, and we have no request from the public to speak on this item.
I'll move to approve those.
I'll second.
All in favor? Any opposed? Any abstentions? Great. Before we conclude, I know you're all ready to put your papers away. I would like to take a moment to recognize our county CEO. Michelle, this is your last commission to address homelessness meeting with us. And I want to personally thank you and anyone else that would like to jump in for your 37 years of service to the county, especially this last gig you've held for the last couple of years. It's not easy to lead this county and all of the responsibilities that you have as our leader, but thank you for your time here, and I hope you're going to go do something amazing in retirement. You're welcome. Yay. So that concludes this meeting of the Commission to Address Homelessness. We are now adjourned, and our regularly scheduled next meeting will be held Wednesday, August 19th at 1 p.m. Thank you, everyone.
Good. Just thought I was gonna have an easy summer, but you keep calling me back. Yeah.